Welcome back. Well, the Western Cape believes it can procure its own COVID-19 vaccines by August. The province has set aside 75 million rand from its health budget for its ambitious plan to bolster the vaccine rollout. Infections among health workers are at an all-time low, and as Lindsay Dentlinger reports, this could be an early sign of the impact of the vaccination program.
About 60% of healthcare workers in the Western Cape have received a jab against COVID-19. And with only 16 active cases, the effects may already be showing. The province is expecting another 36,000 vaccine doses to arrive this weekend. It will allow for 2/3 of the province's health workers to be vaccinated. Despite apparent reluctance from pharmaceutical companies to engage directly with provincial governments for additional vaccines, the Western Cape says it's talking to Johnson & Johnson and Pfizer.
The team is looking at the request for information. As I also indicated, they're looking at the no-fault and the liability issue, because that is quite an issue when you come to the procurement of vaccines. So we're already putting systems in place for that.
Once the province begins phase 2 of the vaccine rollout, age will be the only criteria, starting with those 60 years and older.
When you get to a lower age band, to about 45, we get to that, there is a question of, are you going to differentiate between essential workers and non-essential workers at that point? But that is still a few months away. It's to get going and go via age, and therefore the only criteria is age, not even comorbidities, or at this point in time, whether you're an essential worker or not. It just simplifies the system and the system of fairness and access in terms of all of those.
The province says it has the capacity to vaccinate around 36,000 people a day. Lindsay Dentlinger, Cape Town.